my name is Dr. Cheyenne Warren. I'm the Dental Therapy Program Director in the Hygiene Program at Vermont Technical College on our Williston campus. I'm a dentist, I'm an oral health professional, and before I went to dental school, I got my master's in biochemistry and a PhD I was working on in microbiology while in dental school. And so I'm talking to you today about the COVID-19 vaccine and just giving you some of the concerns and questions that I've come across as we've started to roll out the vaccine. I knew that the vaccine was going to be something that was pushed through as quickly as possible in order to protect as many people as possible. And I knew that as a dental oral health professional, we were going to be on the front lines of getting that vaccine. And I started having anxiety about this over the summer and thought, okay, wait, you're an oral health professional. You think of everything as evidence-based. Let's do some research and see what's going to happen. I'm also a person that comes from a variety of just different medical issues myself. I have an autoimmune disorder that happened after my first pregnancy. I've had chemotherapy, I've had melanoma. And so I had some things that were going on in my own medical history that also gave me pause that I wanted to do some research on again to feel comfortable with the vaccine. I dug right in. I started using actually our hard disk library and PubMed and started researching about the vaccine candidates. And right away, the two RNA vaccines really caught my attention as the ones I was hoping would be the front runners, and they really ended up being that way. So I was really excited when the FDA approved both the Pfizer and the Moderna vaccine. And I myself got the Moderna vaccine a week and a half ago. So I'm happy to report that I have had my first dose and feel very fortunate to have done so. So one of the things that people don't know is this isn't really new vaccine technology. mRNA it has been around in drug development for around 30 years. So it has been tested in humans, not as a vaccine, but as another treatment. They're using it for targeted cancer therapies and other things. So that right away made me feel comfortable with the technology. Also, it's RNA, not DNA. So it's not going to interact with our own DNA or change it. Once we get it into our cells to kind of give them the message to develop the COVID protein and to trick our immune system into protecting us, it's going to be degraded, it's not going to interact, it's not going to mutate, it just goes away. Another thing is this vaccine doesn't have preservatives. Most of our typical standard vaccines have preservatives, and there have been reports that some people have a response to those preservatives, just like we could have a reaction to anything. So it was nice that we don't have to worry about eggs or other preservatives causing reactions in people that might have automatic allergies to those things. They do have lipids in them, which the lipids in both of these vaccines are also in many other drugs. A lot of times for people who are getting laxative drugs or for their colonoscopy preps. And at any time, no matter what we have in our environment, we can develop an allergy at any time. So that's one of the side effects that they see sometimes is people, and they don't know exactly who yet, might have an allergic response. And that's why they're telling us to wait 15 minutes up to an hour in some individuals for those people after they've gotten their first and second dose of the vaccine to be monitored in case they're having any sort of allergic reaction. In all of vaccine development, there's been no evidence-based long-term side effects in any vaccination past the 6-week mark. So that was also a really interesting statistic to me, that if you hadn't gone searching for it, you probably didn't know that, but that was also very reassuring. And there really isn't anything else that's in the vaccine aside from the RNA to tell us to make antibodies to COVID. Sugar, water, saline, and the lipid. So I felt really confident in taking this vaccine, and that the side effects that I would expect to see once I got the vaccine were just my immune system being triggered and doing what it's supposed to do. Again, I just want to say there are some side effects, but they're very minor, and it's not something we should be afraid of. And I hope that you get your vaccine soon.